The key realization behind the Wyden-Bennett bill is the understanding that you cannot fix health care without changing the tax laws. So you have to start with the tax laws. And the tax laws drive you into a system that is irrational, a system where market forces are not allowed to penetrate. This is the only portion of the economy, and it constitutes, depending on who's doing the calculating, 16 to 17% of GDP, where the user of the service does not control the dollars that pays for the service. And so you have competing agendas. The person spending the dollars, or the institution spending the dollars, has one agenda. The person receiving the service has a different agenda. They do not match. Market forces are therefore frustrated, and you end up with the mess that we have. So the thing that attracted me the most to the Wyden proposal, and the thing I've been preaching the longest, is that you have to break the link between the employer and the employee in terms of how the money is controlled. You have to put the control of the dollars into the hands of the employee, into the hands of the person who's receiving the service, so that he or she can say, I don't like what I'm getting, and I'm taking my dollars down the street to go to somebody who's offering something different. Only then will you get any market forces into the system. As long as the dollars are being controlled by the employer, the employee is out of luck in terms of trying to change the situation. During the debate over Hillary Care, the chant that we heard over and over again was, we want the same program members of Congress have. And I said, I want the program I had before I came to Congress, because I was the CEO of the company, and therefore I got to pick. I was probably the only one who got to pick. But I got to pick what kind of a plan we would have as the final decision maker in the company, which meant my decision applied to every employee in the company, and I really liked the plan we had. And when I got to Congress, I found that some committee somewhere got to pick, and while the program was very nice, it wasn't as nice as the one I had. This violates, again, all of the rules of the way a marketplace should work. If it's my money, I should get to pick in every circumstance. So when I realized that Ron Wyden had come to that same conclusion and was saying that the individual gets to control the money, I knew we were on the right road. Now, Republicans have always fought the idea of universal coverage because we have always assumed correctly the universal coverage is code word for single-payer government-run system. And I had to make, just as Ron had to make the leap towards let's get rid of the tax laws that keep the individual from exercising his or her rights in the marketplace, I had to make the leap that said we've got to move towards a form of universal coverage. Now, I made absolutely sure Ron was not talking about a single-payer government-run system, and he's not, to his credit. When we were at the New York Times, before the editorial board, I can't get into the New York Times, the editorial board. They don't talk to Republicans. But Ron could get in, and he took me with him. And we were explaining this, and then the New York Times healthcare expert got a little impatient, and she said, now wait a minute, this is all very well and good, but let me ask you a theoretical question. She said, if you had to pick between the Healthy Americans Act, which is what we've named our bill, if we had to pick between the Healthy Americans Act and a single-payer government-run system, starting from scratch, clean sheet of paper, which would you pick? And of course, she knew the answer I would give, so she didn't ask me the question. And Ron said instantly, I would choose the Healthy Americans Act. A single-payer, government-run system doesn't work. And she was stunned, and I was thrilled, and I knew we were on the right track. All right. Why do I concede the idea, as opposed to the code word, of universal coverage? Because de facto we have universal coverage now. It's called an emergency room. And someone without any insurance, without any coverage, without any money can, will, and does walk into an emergency room any hour of the day and night and get treated. And who pays for that? All the rest of us. So if we have de facto universal coverage, why don't we organize it in a way that makes sense? Because the way it's operating now does not make sense. It has a whole series of perverse consequences. Number one, it's very expensive. It is the most expensive care you can get. Number two, it's usually care that is delayed, that they go into the emergency room long after they should have done in terms of serious problems. Or number three, it's frivolous. I had a constituent say to me, she had a problem with one of her children. It was a true emergency. She rushed into the emergency room, and they were working to try to solve this problem. She happened to overhear conversations between another person in the emergency room who had no insurance, had no coverage, had no money, and had a child with an ear infection, and took it to the emergency room, and was tying up the emergency room with something that could have been handled in a routine office visit if she had had any kind of understanding of the way the system works that most of us have. So, frivolous, expensive, and not very effective in terms of those who have serious problems. So, let's Republicans understand we've got to have a systemized way of providing health care to everybody, and in the end it will be cheaper and more efficient than what we have now. And the de facto situation now is that universal coverage is available. So, if Ron's willing to amend the tax laws to give the employees power over their own money, and I'm willing to say, well, let's cover everybody, that's the backbone at the basis of this bill. But the devil is in the details beyond that. I won't go into those in this opening statement because we'll undoubtedly get into those with the panel as they go after us. But there are several other comments that I want to make. As we've gone down this road, and Ron and I have been at this now for over a year, because he came to me fairly early after the Democrats got control, and I'm flattered that I'm the one he came to for this. Number one, we've made this what Mary Landrieu calls the Noah's Ark bill. We take co-sponsors on 2 by 2. And that means one Republican and one Democrat. It was not announced as the Wyden bill. It was announced as the Healthy Americans Act, co-sponsored by Senator Wyden and Senator Bennett. And I always call it appropriately the Wyden-Bennett bill, and he always calls it courteously the Bennett-Wyden bill, and that's the spirit in which we've approached it.